Albert Schweitzer once said, "Happiness is nothing more than good health and a bad memory." Everyone has a bad memory these days, so let's focus on good health. Good evening. Welcome to BMC Global Life Al-HILAL Health World, nothing but lifestyle. Today we'll be discussing about sinusitis, an inflammation or infection that starts across the tissues around the sinuses. And to give more insights on this topic, we have with us Dr. Sreeja Raj, ENT specialist at Alhilal Hospital's Hamad Town. Welcome to the show, doctor.
Thank you.
Sinusitis often starts as an infection, but most of them consider it as a disorder. So what is sinusitis?
Yeah, sinusitis is a relatively very common condition which we come across, and it represents a significant disease burden worldwide, and it affects more than 10% of the population as well. So yeah, before I proceed with discussing regarding the sinusitis, I would like to give a brief description of the structure of the sinuses. The sinuses are nothing but air-filled spaces, or we can say pockets, which are located in various parts in our facial bones and the skull. So depending on their location, they are named. So we have maxillary sinuses, which are located in the cheek on either side, in the cheekbones. And then there is ethmoid sinus, which is located on either side of the root of the nose. It is closely related to the eyes. And then there is the frontal sinus, which is located above the eyes in the forehead region. And we have sphenoid sinus, which is located deep inside, okay? So these sinuses, they have a lining, thin lining of cells, which produces secretions known as mucus. Okay, so now the question arises, why do we have these sinuses? These sinuses function to lighten our skull, the bones, and also they provide resonance to the voice when we speak. And as I said, the secretions which are produced in the sinuses, these are drained into the nose through very narrow channels, and these secretions, the mucus, it helps in filtering the air that we breathe, and it also provides a conditioning effect, and it humidifies the air as well, okay? And these also acts as a heat insulator. So now coming to our question, what exactly sinusitis is? Whenever the lining of the sinuses, it gets inflamed, we call it as sinusitis.
Oh.
So these sinuses, the inflammation, whenever there is inflammation, there will be swelling and congestion. And also it will cause over-secretion, hyper-secretion of the mucus. And this congestion and obstruction, it will lead to further narrowing of the drainage pathway of the sinuses. Sinuses are nothing but, as I said, we can consider it as small rooms which are having a very narrow doorway through which the secretions drain into the nose. So it is already narrow, and whenever there is congestion and the swelling, it will cause further narrowing. So this will affect the clearance mechanism. As a result, there will be stagnation of secretion within the sinuses. So whenever there is stasis, it will attract the bacteria, there will be bacterial colonization, and this will lead to pus formation.
Okay. Ma'am, you mentioned about the types of sinuses that we have.
Yeah.
4 types: maxillary, frontal, ethmoid and sphenoid. Which sinus is most commonly involved in sinusitis?
Yeah, in the clinical practice, we come across patients. Most commonly, we see that the maxillary sinuses are affected. And we can say in children, the ethmoid sinuses are affected more frequently. But it is very common to see more than one sinus getting involved at the same time, because the group of sinuses have the common drainage pathway. So whenever the drainage pathway is affected, these sinuses are affected. And also we can see that sometimes all the sinuses of one side or both the sides are affected simultaneously, and this we call as pansinusitis.
No. So we talked about what is sinusitis and what sinuses is involved in this. So what causes sinusitis?
Sinusitis is the sinuses. Our sinuses drain into the nose. So any condition or any pathology which affects the nose will affect the sinus as well. So coming to the causes, we can say any factor which causes obstruction to the nose or any obstruction to the drainage pathway of the sinuses. Like we can say a deviation in the nasal septum, any bend in the septum that we have in the middle of the nose. If it is tilted to one side, it will cause obstruction on that particular side and predisposes to sinus infection. Also, sometimes we have hypertrophy of the turbinates. That means the bones in the nose, it might get enlarged. Causes might be allergy or infection, and also any swelling in the mucosa of the nose. These will obstruct the drainage of the sinuses. Also, any injury or trauma to the nose or even the sinuses or the facial bones, these predispose to infection. And sometimes we can also see that any dental infection can also cause sinusitis.
Okay.
And we can say that there are certain environmental factors as well, because it's more common in the cold and wet climatic conditions. And also we notice that environmental pollution, smoking and dust, they also play a role. And rarely we have seen that there is a condition called cystic fibrosis, which is an inborn error in which the mucus secretion itself is very thick and viscous. So when it is thick and viscous, it won't be drained out properly, thereby leading to clogging of the sinuses, as a result of which there might be infection as well.
Okay. Ma'am, I was looking about sinusitis in Google. So it said it's also an infection and a disorder. It depends on the intensity.
Yes.
So if it's chronic, it becomes a disorder. So what are the distinct differences in acute and chronic sinusitis?
We usually divide or classify sinusitis into acute and chronic based on the duration of symptoms.
Okay.
So we say it is acute sinusitis if the symptoms are lasting for less than 12 weeks. Okay, and chronic if it is more than 12 weeks. This chronic sinusitis, we again divide into chronic sinusitis with polyps and without nasal polyps. In chronic sinusitis, the symptoms are similar to acute, but it is less severe. So we can say it is a milder version, but it persists for a long period of time. And the factors which cause chronic sinusitis, it is like persistent obstruction, which cannot be relieved even with medication most of the time.
Okay. What are the symptoms of sinusitis and how do we diagnose it, ma'am?
Sinusitis is a diagnosis that can be made on clinical grounds based on the symptoms, and also we can go for tests to know the evidence of inflammation, as well as imaging can be done to confirm the site of obstruction and how much it is, how severe it is. So coming to the symptoms, usually the patient presents with nasal obstruction or blockage of the nose, and it is more severe at the night. So the patient will have difficulty in breathing, as a result of which they will open the mouth, and due to mouth breathing, the air won't be filtered as it goes through the nose. So there will be dryness of the throat, and this leads to sleep disturbances, and thereby it affects the quality of life. So, and the next commonly seen symptom is nasal discharge, and initially it will be like watery, but whenever there is bacterial colonization and infection, it will become thick and yellowish and greenish. This discharge might come from the front of the nose, or it might go backward and then it drips into the throat, which we call as postnasal drip. So when there is postnasal drip, the patient will have repeated throat clearing also. And patient will have facial pain and pressure. They will complain of headache and heaviness of the head.
Migraines are also part of this.
Migraine is not a part, it is a different entity, but commonly people confuse migraine with sinusitis as well, because headache is common to both. So this headache, it will be in the region of the sinuses more. Like if there is maxillary sinusitis, there will be heaviness and congestion in the maxillary area, and then between the eyes or forehead, sometimes even behind the head and in the vertex region as well. So it's common for people to confuse it with migraine. But in migraine, it is a totally different topic. We need another discussion for that. So, and because of nasal obstruction, people will have difficulty in sensing the smell, and sometimes even the taste might also be affected. And also coming to tests which we can do for better visualization inside the nose, we need to go for a nasal endoscopy. So endoscopy is done with a camera. Thin camera will be passed through the nose and it will be passed inside, so that we can have a better picture of the condition inside the nose, as well as the drainage pathway from the sinuses where it opens into the nose, that can be visualized. And if there is thick discharge, which it can be suctioned out under the endoscopic guidance. It's an OP procedure. We can do it under local anesthesia. We'll spray local anesthetic and then we can do the endoscopy. So, but with endoscopy, we have a picture of the nose and the opening of the sinus. But for visualization, to know what is the situation in the sinuses, we will have to go for a CT scan. So that we will have a better picture about the sinus and the surrounding structures. So in sinusitis, the gold standard investigations right now is nasal endoscopy and CT scan. And blood investigations also act as an adjunct.
What are the treatments for sinusitis, ma'am?
The treatment for sinusitis, initially we go for conservative medical management, like when there is a patient coming with symptoms of sinusitis and we suspect it, and then we can go for nasal wash, which is nasal douching, to clear out the stagnant secretions. And we advise nasal decongestants to reduce the swelling in the nose, so that the secretions can drain out more clearly, more easily. And also we can go for topical steroid nasal sprays and oral antihistamines, and for the headache we can go for analgesics also. And if the patient is not responding to these, or if it is lasting for more than 7 to 10 days and there is bacterial infection, antibiotics will provide definite benefit to the patient. And in chronic sinusitis also, we suggest maximal medical therapy. First, we will try with the medical treatment, and if the patient is not responding to this maximal medical therapy, then we do advise for surgery. And the surgery is aimed at relieving the obstruction to the drainage pathway of the sinuses, which can be done under endoscopic guidance. And we will open up the sinuses so that the secretions in the sinuses drain out freely into the nose, so that there is no stagnant secretions. Also, the medicines which we use in the nose, the sprays or the nasal wash, it can go inside the sinuses easily if the obstruction is relieved, so as to prevent further infection.
Ma'am, these symptoms are often confused with influenza or cold, or common cold, and people often neglect this. And they just don't see go to hospitals regarding this. So what is the severity or the complications of this sinusitis?
Yeah, there are certain complications of sinusitis, and we suspect a complication when the sinusitis or the infection, the secretion, it is not limited to the sinus. When it extends beyond the sinuses, there is a complication. So these complications happen if there is expansion or erosion of the sinus wall, and then it extends beyond it. And in such cases, it might infect the bone, leading to osteomyelitis. And as the ethmoid sinuses are closely related to the eyes, and any spread of infection will affect the eyes and structures in the eyes. And this will have serious complications, serious effects. And the sinuses are related to the skull base as well. So the complications might lead to infection in the brain, like meningitis or abscess formation also.
Okay. That was the last question, doctor. Thank you so much for your valuable insights on this topic. I hope you had a great time with us as well.
Thank you. Thank you so much.
I hope you all understand now the importance of sinusitis and its causes. For more such valuable insights and health-related topics, please tune into Al-HILAL Health World every Tuesdays at 8 p.m. only on BMC Global Life. I'm Abhijit Joseph signing off. Good night.